Did you know that 2.8 million people are estimated to live with multiple sclerosis worldwide? Multiple sclerosis, also known as MS, is a long-term disease where the immune system mistakenly attacks the protective layer around nerve fibers, known as the myelin sheath. The myelin sheath acts as an insulator, protecting nerve cells and allowing electrical impulses to travel quickly and efficiently. As the myelin is attacked, it becomes destroyed in many areas. Depending on where the nerve damage happens, MS can affect vision, sensation, coordination, movement, and bladder or bowel control. When the nerves are damaged in this way, the communication between the brain and the rest of the body is interrupted. Eventually, the disease can cause permanent damage of the nerve fibers. Multiple sclerosis is classified as types. MS types depend on the progression of symptoms and frequency of relapses. Most people with multiple sclerosis have the relapsing-remitting type. They experience periods of new symptoms or relapses that develop over days or weeks. They typically improve partially or completely. The relapses are then followed by periods of remission that can last for months or years. The precise cause of MS is unknown, but a combination of genetics and environmental factors may increase the risk of MS. MS is an unpredictable disease that affects people differently. No two people have exactly the same symptoms. These symptoms can also change or fluctuate over time. Some people may experience blurred or double vision, walking difficulties, balance difficulties, muscle weakness, or cognitive changes. For many people living with MS, fatigue is the most prominent symptom. Unfortunately, there is no cure for multiple sclerosis, but there are various treatment options that can help manage it. Treatment will depend on the patient's symptoms, age, general health, and the severity of the condition. There are several different treatments that focus on controlling the immune system, managing symptoms, and slowing the progression of the disease. Currently, the progression of the disease is slowed by using a drug therapy approach called disease-modifying treatments, DMTs. DMTs are the main group of medications used to treat MS patients. Treatment options for relapsing-remitting MS are available in 3 different forms: injections, oral therapies, and IV infusions. Injectable treatments include interferon beta medications. These medications suppresses inflammatory responses through different mechanisms in MS patients. This works by interfering with diseases that attack the body. It helps decrease inflammation and increase nerve growth. Interferon beta medicines are injected under the skin or into the muscle. Your immune system makes special types of cells to kill viruses and bacteria, but in MS, these cells are thought to target nerves in your brain and spinal cord by mistake. Infusion treatments called natalizumab sticks to these cells. It stops them before they reach a person's brain and spinal cord, where they would attack the myelin around the nerves. Another treatment option is an oral therapy or ingestible tablet. Cladribine kills certain types of blood cells made by your immune system. These cells normally attack viruses and bacteria that get into your body. But since in MS these cells attack the myelin, the cladribine stops these cells from getting into your brain and spinal cord so they don't do damage in there. Scientists are continuously seeking new insight into the risk factors and causes of MS and potential treatment strategies. MS affects everyone differently, and no one can predict how it may impact the individual. Healthy behaviors can positively impact MS progression and the lifespan of the individual. Despite MS being a challenging disease to live with and manage, most individuals can still live an active and fulfilling life.